So Akash, do you want to start with reintroduction maybe?
Yeah, sure. So for those that maybe weren't here in the morning, my name is Akash. I'm the second year medical affairs fellow here at UCB.
Hi everyone, my name is Logan Van Ravensway. I'm a second year healthcare education and outcomes research fellow with the CEA.
Hi everyone, my name is Walter Ebile. I'm the second year fellow in global clinical science and operations.
All right, so the first question is, what has been your favorite, most impactful experience so far as a PharmD fellow?
I can guess right away, and then you can pass it down the line. So for me, I think with the way our fellowship program is structured, being in medical strategy, we get really inundated in the day-to-day operations and what impact our strategies have for the company. And so as part of that, Shelly and I just ran the 2025 internal strategic planning meeting. So it's an opportunity for both first and second year fellows not only to learn about what every specific subfunction medical affairs is doing, but also the type of budgets that are required, the type of collaboration that's needed, and just being able to spearhead that type of project and sort of help organize and align our organization for the 2025 year has been really rewarding. So I'd say that's for me.
I think from my perspective, it's been the hands-on experience. Because with my fellowship, I work in healthcare education or independent medical education. And in school, that's not something that's ever really discussed. And it's more of just, oh, you need so many hours to maintain your license. But with this fellowship, it's afforded me the opportunity to really get into like the nitty-gritty on what different healthcare professionals need to know and kind of be proactive in trying to meet those challenges head on.
Yeah, so my perspective, so I when I joined the fellowship, I was part of a new study that was the PS39. So this is a study on arthritis, psoriatic arthritis study. So when I started off, it was a good time for me because I was included into the study concept team. So I was part of the team from designing the study concept right all the way. And recently we just achieved a very significant milestone, which they call first patient, first visit. So the study just started on one of our sites. So I think that is the most thing I'm proud of at this time that I was part of that team. Yeah.
All right, Akash, we'll go back to you.
Sure.
What are some challenges you face in your fellowship and how did you overcome them?
Yeah, great question. I think my first challenge I think that I had was just first off shaking off that student mindset. Callie, I know you know I've spoken about this before, but in school and when you're on rotations, you're afraid to ask those questions. You're afraid to be wrong. You're afraid to step out of your comfort zone a little bit because you're fearing being judged or graded. Whereas in a fellowship, the intention is that you're here to learn. You're here to ask those questions. You're here to make those mistakes so that way you can set up your foundation. So for me, it took a little bit longer to shake that, just I think because of when I came in and where the product was that I'm supporting was in the pipeline. But as soon as I was able to shake that, I think the next biggest thing was just I think like corporate awareness, right? You're always told in pharmacy school that being professional is important and how you present yourself is important, but you don't realize until you step into a corporate setting how really truly important it is. Tay, my fellowship preceptor, did a presentation to USLT about how this is the first time in United States history that there's 6 generations working together at once. And so just thinking about that, right, we're on the lower end, but how different generations and different levels of the organization interact and operate, right? Something that we might think is okay, me sitting like this, for example, may be okay with our generation, but there might be people in the audience right now that think, oh man, that guy's really unprofessional, right? So just thinking about things in that corporate setting, I would say.
When I first started with CEA, I think I faced 2 significant challenges right off the bat, and that being number 1, we were a remote company, and number 2, I was one of the first fellows to go through the program, and so being remote, you have to constantly introduce yourself, be like, starting with the CEA, this is what I can provide, let me know how I can help you, and then from the first-time fellow or the new fellowship program, you're encountering people that don't really know what fellows do. And so you're also advocating for yourself. You're getting involved early on. You're trying to volunteer with as many different teams as you can, not only to give yourself exposure to the different projects, but also let the team members know what you're capable of. So that way, when new fellows come in, they have a much easier transition to the program. And so it will be easier to create those long-term projects for those new fellows.
Yeah, and I absolutely want to echo what my colleagues just said, because I think I have similar experience like both of you, but essentially they have different challenges, several of them. But I'll summarize two key ones. The first one is being able to find my voice in the team was very critical. You know, as a new fellow, when you joined and you get inserted into different teams and you work with people who have a lot of experience, 10, 20, even 30 years of experience, they know so much. And being part of that team is difficult for you to really find your voice and be able to contribute in a meaningful way that will add value. I think that was a very big challenge. And I was just patient with myself, taking one day at a time and learning and trying to have a concept of what we are doing. Then eventually your voice, you will start finding your voice and contribute to the team. And then the second thing that I wanted to say was actually, it's also difficult to identify what you don't know. A lot of times you go and maybe in one rotation there are objectives. You'll be focused on completing those objectives, but technically there are other things that you have no idea. So being able to really identify all the things that you need to know that you don't know, it's a very big step and it's very challenging. And one way to help with that is that I try to ask questions a lot. I try to have one-on-ones with the directors, with the preceptors, with colleagues, and see their perspectives, how they think, and also even ask them questions about the company's vision, long-term, short-term. I think all those make a big difference in your growth.
It's okay to ask question now, but you have to listen to it. Okay. I know that you guys touched a little bit on the challenges that you had transition, but is it possible to give like maybe one or two pieces like core advice of how to not necessarily move from a student perspective to a fellow perspective, but like how to operate? Even when you say you have to ask questions, how do you ask questions? Yeah. How do you show that you want to take initiative, but then also you're curious to learn, but then again you also really don't know what you're talking about in that way. So is it okay if you guys share a little bit about that perspective as well?
Yeah, I think two things that my preceptor really challenges me to do is to be A, proactive, and B, naturally inquisitive, right? So it's very cliche, right? But there's no such thing as a dumb question. Now, when you ask those questions, it's a different story, right? I don't want to stop a meeting with 8 executive level people that I'm sitting in on to say, hey, what does this acronym mean, right? So again, bringing about that corporate awareness, but following up on those questions that you have, right? Nobody's gonna think any less of you if you pull them to the side after the meeting or if you send a separate email and say, hey, I really appreciate your time. Following up from the meeting today, could you please explain this to me further, right? I think being proactive in your learning and figuring out those things that you don't know is gonna really help you set up yourself further down. I think it also helps build that strategic mindset if you're always asking, why and what. Why is this important? What am I doing? And how does this have value? You'd be surprised. You can provide a lot of insight and a way of thinking that some of the senior leaders at the companies may not be aware of, right? Like we said, we're the youngest of the 6 generations, so we are more familiar with things that the older generations might not be. And that may help shape a strategy, shape a meeting, make a decision. You never know what your impact might be. So always ask those questions, follow up on those questions. And if you are told to follow up on something for a meeting, follow up on it. Hold yourself accountable and be okay with talking to your preceptor both in good and positive ways, or good and negative ways, sorry. So my preceptor and I have set time every week for a one-on-one, and then we also have set time with Shelby and I both to be there together, right? So I make it an intentional point. This is very cheesy, but it's on Friday, so it's Feedback Fridays, right? I'm making it a point every week to ask questions. What am I doing well? What do I need to improve in? What would you like to see from me in the next week, right? Because ultimately you're going to have your performance reviews. You're going to you're going to need to bring back some of this feedback to show how you've grown. So if you're getting it a little bit along the way, I think it'll help you sort of structure your growth a little bit more. And then that way, if let's say Tay says, you know, you're really good at XYZ, but I'd really like you to improve in this, you can address it earlier on.
The worst time to find out your feedback is in your performance review for the first time.
Yep.
Yeah.
So
Exactly.
I support that 100%. Know where you stand and do little course corrections along the way.
From my perspective, again, I think just being an active listener is a huge advantage to being in a fellowship position, because ultimately you're there to learn. And so you're going to be in meetings with a bunch of different team members from different functional areas. And so you're going to be presented with a lot of information, sometimes too much to take in one setting, but fortunately there's always a recurring meeting scheduled. And so trying to pick out those key points in those meetings and then follow up with them, kind of like as you were saying. But if anything stands out to you, don't be afraid to schedule a one-on-one, ask them more about it. From my experience, whenever you approach someone about something that you said, they tend to light up about it because that may be a passion of theirs. And so you're learning more about them, not only as a colleague, but also as an individual, giving them that platform to really talk more. And then it's giving you a great chance to know who to find if you ever run into that problem again in the future. And I think the other aspect is be invested in your own development. I know a lot of these programs do a great job at providing you schedules of different rotations, different opportunities, different people to shadow. But if you encounter anything you enjoy, you know, reach out for it yourself. Talk to them, try to line something up, because these companies are invested in you just as much as you are invested in them, and they want to provide that with you. So that's my advice for it.
If I have to add a couple of words to what they said, I would say that very important. Don't just have the meetings, but be strategic. Sometimes we don't just organize one-on-ones because we want to make it a formality, or be objective. What are you looking to get out of this meeting? So when I first started my fellowship, I had a lot of advice that you need to have one-on-ones with colleagues and everyone in the company, which I started off having a lot of one-on-ones. At the end of the month, I looked at myself, what do I remember? Absolutely almost nothing. Because you hear tomorrow, you forget everything. Why? So I decided to come up with a strategy. I said, as opposed to like having one-on-ones, I wanted to be more strategic. So I decided to go by my rotations. So if I have my CPM rotation, clinical project management, for example, I'll start from there. I'll try to reach out to the directors, to the preceptors step by step, in a way that their ideas and contributions to my development will be geared towards me building and growing in that department. But if I go and speak with someone from CPM and then someone in clinical data and innovations, I get a little bit mixed up. But if you can strategize, then you're going to get more out of those meetings.
So kind of transitioning from, talking about getting feedback and learning your weaknesses and honing in on your strengths, how have you guys managed to balance project deadlines with also doing personal development and learning at the same time?
I think the biggest thing is Tay calls it over communication, right? So in my weekly meetings with him, I say, I'm working on projects 1, 2, 3. These are their statuses. These are when they're due. I think this one's feasible. This one may not be. Can I have another week? We'll dig into that a little bit more. Because ultimately, right, you are in the rotation that I'm in, we are helping drive strategy, but Tay will always take time to emphasize and focus on things that we need, right? So, and what I mean by that is if, let's say, I give a presentation and it doesn't go so well, so he wants to work on my scientific vernacular. He'll make it a point to join a separate meeting and say, okay, let's take a couple of these projects off, let's push them away, and let's focus on this for the next 2 weeks so we can get you better. So your preceptors are gonna do that no matter what company you're at. And I think just it's important to express those concerns, express those difficulties that you're having. It doesn't show that you're weak, you're unreliable, right? But I think if you don't tell them what you're struggling with and timelines that might be too pressing, then they're never gonna know. So That's my biggest advice.
Yeah, I think structure and organization is everything. Just making sure that you can meet deliverables on time and to your highest quality. But as you said, communication's everything. What people don't know, they can't really jump in and help. So if there's something you're struggling with, the earlier that you can let someone know, the better, because I'm fortunate, the CEAs, everyone remote, everyone's really understanding of when things come up. So if you can let someone know, that allows them time to pivot, or it allows them to prioritize other things, and then let them know that we can come back or circle back whenever time allows.
Absolutely. I agree completely. Communication is key. And a lot of time as a fellow, you feel the pressure of always accepting and saying yes to everything. And the people assigning this task, they may not necessarily know how much you already have. Your hands may be full and they may not have an idea. So it's good to communicate with your preceptors. And ultimately, if your schedule is already full, it's not wrong to communicate with your preceptor and let them know that maybe you have this and you give them a timeline, maybe I'll be available for this time. Because ultimately, you don't want to rush and get something and then you're not able to deliver well on that assignment. So it's important to also know how much you have already and communicate with your preceptor and know if you have bandwidth to take more.
Another question I had, which is based on this. When it comes to time management, as you know, Madrona's just graduated from school and are interested in taking our boards. So excited about that. So for people, if this panel, nobody, if you haven't taken your exam, that's okay. But if anybody on this panel has taken their exam, can you also share how you manage in the beginning onboarding, taking on projects, and as well studying for your boards?
Yeah. So for full transparency, when I was getting ready to start my fellowship, I not only started a month early, I was also in my MBA capstone, and then also trying to get ready for boards. So it was just a really busy time, and Tay knew all that. Again, so that early communication has been a habit that I've been working on since the beginning. He's also very understanding, so I'm sure your preceptor will as well, in saying, okay, let's dial back sort of any of the work and projects that you're working on. Let's get you 2 weeks, 3 weeks, whatever you need to focus on board prep and onboarding. And then we can worry about the projects later, right? Because Joel, you're gonna be here for 2 years, right? So there's gonna be plenty of time to get work done. There's gonna be plenty of time for deliverables, but these things that you need to set the foundation are gonna be more important, right? So again, just open, honest communication with her where you're at. And if you need more time, that's okay, right? I think looking at Kelly, who was my second year when I started, right? She was a lot quicker to do her onboarding than I was. And that's okay, right? Because there's going to be differences between fellows, but ultimately setting that foundation is what's important. So being patient with your onboarding, making sure you are learning it entirely, and not just like Walter said, like just going through the motions just to get things off of a checklist. And prioritize those things, right? Because at the end of the day, if fellowship is 1, maybe 2 years, you've got to worry about what you're going to be setting yourself up for life, right? So you don't want to go through the motions and then not set yourself up. Sure.
I may not have the best answer to this because I took my boards before I started with my fellowship, but there was a 1 week overlap where I took the MPJE and my first week. But I think just being upfront with what your goals are, that you want to take boards, this is how you're preparing for it. I think that's the most important step. Usually there's some built-in flexibility in your onboarding, so there's ability to change should things arise. But again, I know we're slamming communication a lot, but again, just communicate that up front, and odds are that's going to be the best thing to help.
Yeah, completely agree. I think communication is the key. And I think the first step is planning, knowing ahead of time that you're going to take the board exams is very important. It helps you plan and gauge yourself with the timelines. For example, when I graduated from pharmacy, I was in the middle. I didn't know if I should take it or not. And I finally reached that point to make the decision when I had started my fellowship. And so it took me a little bit more time to prepare for the board exams. And one thing that I knew for sure, I did not want that to interfere with my fellowship because I had prioritized my fellowship, actually. And So what I did was I ultimately gave myself more time to prepare because you have to balance work. I think prioritization is a key word. Prioritize work, and then also be able to create time for yourself because you don't want to be at work or preparing for your exam during work hours. So you want to separate those two. Don't even take your work computer, no, your home computer to work. Some people do that. They take your computer to work and they'll be studying at work. I don't think that's right. So when you're at work, just do work. When you go home, then create time for yourself to study and prepare for the exam.
I think along with communication, something else that you guys have spoke to a few times is being proactive. Could you give us an example of a time where you were proactive and how that led to a positive outcome?
Yeah. An idea that comes to mind, right? I introduced myself this morning outside of my MBA. So whenever I'm doing something that's more clinically focused, I do try to bring in that business aspect. And so one of my major roles as a first-year fellow, now second year, is managing what we call a local Congress budget. So I'm setting up, I'm coordinating with field medical leads to figure out which will we do local congresses our team will have a presence at. What does our presence look like? Do we have a booth there? Do we have a symposium there? What handouts are going there? Which MSLs are going there? Coordinating all that, etc. And this was the first year that the fellow was able to coordinate all that. And so me bringing in my business side, I asked my preceptor, we're going through internal strategic planning. Would it be useful for me to do an ROI analysis, return on investment analysis? Is the $12,000 that we give to this conference really worth it? What output are we getting? He jumped all over it. So I'm in the middle of developing that, and that's going to help shape which conferences and the budget that I get for next year. So I think that is just a question that I asked him that ended up, gaining traction and having hopefully a really big impact.
So with my fellowship, I primarily work in educational grant writing. So there's always a little bit of like problem solving and trying to predict the future in a weird way. Because our work is heavily influenced by the latest emerging data from pharma. And so whenever a new drug comes to market, likely there's going to be an educational need to follow. And so something that I've started to do in my own writing is trying to really take the time and just predict what could go wrong in a weird way. And just sitting at my desk and just asking myself why. And then once I get to a new conclusion, ask why. And trying to incorporate in that writing so that way when the product eventually reaches the patient or the healthcare provider, we want to provide all of that information up front. And so when we communicate that to potential supporters, we can really leverage our value of what our education offers, but then also try to align it with what their objectives are as a company, because we do have to maintain some firewalls to make sure that it's non-biased and still evidence-based, but we want to make sure that the education that we're providing is the most accurate, but also the most well-rounded. So that way, when a healthcare professional participates in an activity, they don't leave with more questions than when they showed up. And I think having that proactive mindset has really improved my own writing, but also improved my relationships with other supporters.
Awesome. Well, for me, in case you may not know, one of the latest news in the industry landscape today is something that they call decentralized clinical trials. So what does that mean? So these are different ways or technologies that they use to streamline clinical studies. For example, as opposed to inviting the patient to the site, you can do like maybe home health nursing. So you care for them and you do the evaluation from their home. So it wants to help the patient, make it more comfortable for the patient, but as well as also save time and money. So they use a lot of technologies to do clinical trials these days. So there is a research paper that came out saying that for companies that apply DCTs, decentralized technologies, that they can save up to like 20 million per phase of clinical trial. So it was a generalistic study involving many companies. So then the clinical data innovations team in UCB has been thinking about that project and see how it applies to UCB. But then the leadership team, they had never had the time to be able to do that kind of study and at UCB to see what level we are. So when I was doing that rotation, I opted to follow through with that project and I took it on. And we found out a lot of similarities between UCB and the company. And I was so proud because through that study, I was able to provide value to show some value to the rest of the team, what kind of technologies we can focus on, which ones are we using more often, and also what are some of the barriers that our operations team are facing. And so it was a great project, and they liked it, and they asked me, requested if I could do a small white paper on it, and I just completed the draft. That was a couple of weeks ago.
That's awesome. Thank you guys so much for your answers. We have about 10 minutes left, so I want to open it up to anybody here, anybody online, for any additional questions you may have.
Don't be shy. I know Joel's gonna ask something.
Well, you know, it's worth the silence. Since you guys are all second-year fellows, correct?
Yeah.
Now we're getting into the phase where, you know, about next year you guys are appointed. How do you guys personally feel that the fellowship is coming to this is more to a personal question. How do you now still feel that the fellowship is coming to an end, passing the reins on to your first year fellow and actually being a full-fledged FT?
Loaded question. I mean, I would be lying if I didn't say I was a little nervous, right? Like I said, in the fellowship program, you have sort of that wiggle room to ask questions, make mistakes, and it's expected that you're there to learn. Whereas when you're full-time employed, it's a little bit more executionary. You kind of there for a role, you need to execute, you need to show value. So the question I find myself asking is, do I have enough knowledge and do I show enough value to be retained by this company? And you'll find that 9 times out of 10, you're being harder on yourself as a fellow than your preceptors are on you. I think looking at how I felt coming into the fellowship versus what I feel now, there's absolutely no doubt in my mind that I've grown, not only in my knowledge, but in my proficiency and sort of my understanding of the ins and outs, the processes, that sort of thing. So if I find myself, like if I'm being very critical, if I look at myself, I think I've grown very broadly, but now I'm trying to be more strategic and saying, okay, UCB has an opening in the field medical team. What do I lack that I need to strengthen in the next year to be able to fill that gap for UCB? So in my second year, I'm being a lot more intentional in figuring out what are my deficiencies and how can I improve them. So that's an ongoing process. But what are you going to say?
I'm going to piggyback on that, and I've given guidance to fellows on this, many times. I think it's a little early right now to start looking for jobs,
Yeah.
but it's not too early to look at the job description of the role that you want to have.
Yep.
And they're out there. Yep. Pick it up any website, LinkedIn, the company job board, and just go down there and look at all the requirements and the skills. And this is your chance. You got a limited time, right? You made a sacrifice in earnings potential in that you could have taken a traditional pharmacy job, probably made a little bit more. But you owe it to yourself to explore all these things that you can while you've been given the opportunity. The stakes get higher later. But yeah, that's one of my top pieces of advice to the fellows, just ongoing throughout, your time. Keep a checklist and keep checking in with your manager, your preceptor. Hey, here's what we said I was going to accomplish during this block. Here's the things I've done. Here's what we have. How are we going to get that experience now? And then on the more macro sense, that job description, and don't give up until you've mapped your experiences against everything on that job description.
And what I was gonna just ask quickly, so Akash is, and just like you said, in those period of time that we have that we're very saying that, okay, this is the job description that I want, and this is what I'm liking. Are you doing more introspective research on yourself, or are you being proactive in talking to your preceptor about that? or
Yeah. No, I think it's both.
Okay.
Right? So being completely candid, right? When I first started my fellowship, I thought I was really good at presenting my scientific knowledge, right? But I learned quickly that my scientific knowledge presenting skills were mainly the academic focus. Whereas here you have to really adapt and show why is this relevant to the company, right? So that was something very easily on that I reflected on my own experience and saying, okay, how do I get better at showing value in my scientific presentations? Then I proactively talked to Tay, like, I want to do more scientific presentations, more journal clubs on a weekly or on a monthly basis, so that way I can get more practice. That way they feel more comfortable with me being in the field, but then I also feel more comfortable in that I'm ready for a field MSL role should, that opportunity come up to me. So it's a little bit of both. Yeah.
I'd say I'm both excited, but also at the same time a little anxious. And excited because I've just spent 1 year with this company. I've truly grown as a professional. So I'm really excited to start applying what I've learned, as well as applying the projects that I've worked on. But I think anxious just because you have this upcoming timeline coming up and you trying to, like, personally, I'm a structured person. And then there's just, after the year, it's this period of the unknown and lacking structure. So obviously I'm a little anxious there. But I think, as Jim said, there's still so much to gain from the second year of your fellowship. And so not trying to rush finding a follow-up position, but instead just get out of what you can from your fellowship, because that's going to help you take that next step. And as Jim also said, one thing that I've started to do is try to find jobs that I'm interested in. Even if I don't apply to them, I can build a repository of responsibilities that I can take to my manager and be like, oh, this is a common theme of all these jobs that I'm finding. I feel like I have a little experience here, but I'd love to develop here further. And then being proactive in your development and trying to get exposure to those responsibilities is going to be crucial. So that way, when you do take that next step, you will be able to, spotlight yourself, really speak at volumes of what you're capable of, what you bring to the team, and really communicate why that company should pick you.
Absolutely. I do really agree very much with what you say, especially what Jim said. The priority now for me in the next 6 months is to make sure that I check all the boxes. Like what Jim said, if you don't know what is in the market, what is expected of you of that specific position, then you will not be able to prepare yourself appropriately. So that's one of the recommendations that I'm doing. So before I start every rotation, I look at a job description and I come up with my own personal objective and I discuss it with my preceptor to see if these are things that we can achieve or not. So right now I'm focusing on checking those boxes as much as I can. And ultimately, I feel lucky that I have a great director who is very understanding and even more proactive than myself, and who is already engaging in those discussions, what happened next. I feel very lucky and fortunate in that respect. But I know the ultimate goal is to get myself ready on day one, because it's good to have a job, but it's also good, but more important to keep the job.
I know I have one personally. As second year fellows now, was there anything that you guys learned as the new first year fellows came on, like whether in general or about yourselves, and now that you were a little bit more tenured, and like how that dynamic was for you?
Shelby, I may put you on the spot and ask if you want to contribute too, but Shelby's my first year fellow, and I think I've personally loved having a second or another fellow under me, just because it's given me an opportunity to teach and sort of reinforce my knowledge, but then also say, if Shelby asks me a question that I don't have an answer to, that signals to me that that's a knowledge gap that I need to address. So I think it's not only helpful for her and that it's helping her onboard, but also it helps me figure out what I know, what I don't know, and what I need to improve on. So I love it. I think it's great.
Yeah, I've really enjoyed it too. Lean's right here, our first year fellow. But it was almost like an overnight switch. You go from being a first year fellow to a second year fellow.
It's true.
And
It's true.
you get all these new responsibilities,
Yeah.
but you don't really get time to acclimate yourself.
Yeah.
But I've really enjoyed it because I've always enjoyed being a teacher, a tutor. And so one thing that you'll quickly realize is everybody has their different learning style, and trying to find a way that best reflects their learning approach. Sometimes explaining things differently, providing more examples, things like that. I think, again, since I love that tutor background, I really enjoy it because it's almost like a puzzle that you're trying to fit all the pieces into. But the leadership aspect of a fellowship is really a great part and reason to continue into the second year.
Yeah.
Thank you.
Where's my shadow?
You look bad.
I would say the same thing. Actually, when I started, I was the pioneer fellow for the GCS. I was the first fellow. So fortunately, we did not have a fellow before with the GCS. So I actually tapped into, regulatory affairs with Kevin, who was there, with Osa, who was in patient safety. He gave me a lot of support, and I received a lot of love and support from the preceptors too. And I just want to transfer that right back to Tasia. She's fantastic. We are more of a team, and we just work every day closely and have discussions on issues and just.
Give you a heart on the screen.
Aww.
You're amazing, Josh. I say that because I'm the first year pioneer inaugural fellow, so I don't have anybody to look up to, but these great people in front of me.
Yeah.
And beside, yes, all around.